I am Sona Handa Arora, and I welcome you to this Fireside Talk show today organized by Skyways Group. Skyways has been one of the leading logistics conglomerates with services expanded into air freight, ocean freight, trucking, courier, e-commerce, logistics, learning, and technology for the last 38 years. It gives me a great pleasure to introduce our managing director, Mr. Yashpal Sharma, who will be one of the panelists for this Fireside Talk show today. Yash, as the world calls him, has been in the logistics industry since 1995 and has been instrumental to take Skyways from a 17-member team to 70 plus team members, an expanded footprint into 30 plus locations in India, Bangladesh, Vietnam, Germany, and recently launched an office in the UAE. Let me now request him to take over the show and introduce the fellow panelists. I wish all of you a very engaging and interesting next 1 hour. Over to you, Yash.
I thank you, Sona, for the quick introduction. Very good afternoon, good evening, and good morning to Dr. Gopal and everybody in the States. It's a great pleasure to have everybody on this show. The last 16 months have been extremely tough for mankind, from locking to unlocking, of the economies of the world. We have seen so much all around, from job losses to retaining people to trying to get healthcare for our loved ones. We've kind of seen it all. COVID has brought a lot of unexpected to the whole world. We saw in real what we thought was only possible in movies. These kind of things that we saw were absolutely unimaginable in the real world. Especially the second wave was extremely cruel in parts of India and some parts of the world as well. There has been also a lot of changes to businesses, to habits, to the way we live our life. Some of these changes are temporary and some of these changes are absolute permanent. While we've been hearing so much on COVID, on TV, on social media and stuff, but today we're going to keep this talk slightly different. We will talk about challenges that everyone's had with regard to their physical as well as mental self, and possibly what you can do to get out of them and improve yourself. And we would also deliberate on certain impacts that COVID has left on businesses. Unlike webinars, this is a fireside talk show, which means that the panelists that you will have on the screen are going to have a casual discussion with each other and throw points and throw talking points to each other and probably seek comments of each other. While Sona has given a brief about me, I will take a minute to quickly brief our lovely, fantastic panelists that we have here. First of all, I would like to welcome Dr. Gopal Sankaran, who's a tenured full professor in public health at Westchester University of Pennsylvania. Having done his initial education in India, he moved to the US and did his master's and doctoral degrees in public health from University of California at Berkeley. He's a certified health education specialist. We definitely need a lot of solid inputs from him to get us out of all the mental stigmas that we might have taken into. Welcome, Dr. Gopal, to our show. The second panelist that we have is Dr. Ganesh Kumar Mani. He's chairman cardiothoracic vascular surgery at the Max Super Speciality Hospital, Saket, in New Delhi. It's a great honor to have you, sir. Dr. Mani has been honored by the government of India in 2013, and he was bestowed upon a Padma Shri, which is the highest civilian award in India for his contribution to the fields of medicine as well as medical education. My fourth panelist on the talk show is Dr. Sanjay Agarwal, an extremely well-known name in the business community. He is the chairman and CEO for Paramount Communications Limited. Mr. Sanjay Agarwal is chairman and CEO of Paramount Cables, and he's also the president of PhD Chamber of Commerce and Industry for 2021. Mr. Agarwal has been the recipient of many prestigious awards, over the last 37 years, which includes National Small Industry Award, which he got in 1984, which was given by the President of India. And he also got the Entrepreneur of the Year Award in 1994 from All India Manufacturers Association. I welcome you, Mr. Sanjay Agarwal, on our talk show. He was driving into his place where he's going to talk from. I think he's getting into home, so he will have his camera switched on very quickly as soon as he gets on his desk. So let's get on with things. So welcome, gentlemen. I welcome you, and let's have a engaging 1 hour with our audience. We've got audience from all over the world. As I've been told by the organizers that we already had 200 plus attendees the moment we got logged in, and I'm sure more will come in as they get home, probably from their works and or as they get free from their other course of the day. So let me start by throwing in a point to Dr. Mani. Dr. Mani, everything today all over the world, everybody's very, very keen to know exactly what's happening on the vaccine front, because vaccines are the saviors. We all see them as a possible saviors for mankind and will probably help us to bring life back to normal. So while there are a few vaccines already available, do you see more vaccines coming in very quickly and kind of helping the world to fast track normalcy in the near future? And also a follow-up I would like to have your comment on is, when do you think in India especially we'll be able to develop a herd immunity and probably in other parts of the world as well? Dr. Mani.
Thank you, Yash. It's a multifaceted question that you've asked. And well, I think we will start with the fact that basically there are two types of. One is the RNA vaccines, which are basically only the Pfizer and the Moderna. And there are other types of vaccines. There are more vaccines coming up. As we speak, vaccines are being developed. In relevance to India, we have the Covishield and the Covaxin vaccines, which are quite prevalent and which is used in the large community. And we have vaccinated a large proportion of the population. Still a lot to be vaccinated, but large have been vaccinated. Between Covishield and Covaxin, there have been proponents of both. And I think with the increased acceptance of Covaxin in many other countries, I think that will probably be the need of the hour. Having said that, the Johnson & Johnson vaccine is also getting available. The Sputnik is already here. And there are many more vaccines in the making. My only point is, it is finally the immunity that is going to save us. The vaccines are only going to increase our immunity. And that is our armor against the future variants and the future infections. Now, as we are speaking, the virus is mutating. And we have gone through various waves here, and we do not know whether we had the second wave or the third wave, but the Delta wave was scaring, and it's a double mutant which has really bothered us. If that has been the second wave, then the third wave is imminent, and we do not know where we stand. All our hospitals are doubly, triply ready. We have got, in Max itself, we have got 100 beds ready for use, fully fitted with oxygen and, ventilators and everything, and so on and so forth. This is the corporate contribution. In addition to that, the government has made huge strides in getting prepared for the third wave. So having said that, as you very rightly, a portion of your question was, when do we get into a herd immunity situation? As I said, as my opening was, immunity is the answer. And immunity for 1 and 2 and 3 is not enough. The whole whole population has to have herd immunity. They say there is a percentage attributed to it. When 70% people are having antibodies in their blood, then the virus will be finally killed or finally disappear. I think we can't have a better person to answer this question than Dr. Gopal Shankaran, professor of public health at Pennsylvania. Gopal, what is your impression? When do we think that India will have herd immunity?
Thank you, Mr. Yashchi, for a wonderful introduction, and thank you, Dr. Mani, for the great question. I think I wish I had a crystal ball to look through and then give the correct answer. The challenge is that the vaccines, there are two ways to develop that protection. One is the vaccines, and the other is to get the natural infection and develop the immunity after getting the natural infection. The good news to a certain extent is that the seroprevalence survey, which the ICMR has done, is showing that almost a little over 60% of the people are already got the antibodies to it. But there are several questions which we still don't know. One is, how long will the antibodies last in terms of giving protection against a new infection for the same individuals who have already been infected and develop antibodies? That's one thing. The second question, which is also a troublesome question, is how long will the immunity from the vaccines last? So we have two questions, the two modes, the two strategies which are naturally present to ward off any of the future threats in terms of raising the herd immunity. We don't have good answers to them as yet. To complicate this matter a little bit more, which Dr. Mani alluded to, is the presence of variants. So if we have vaccines which are protecting us, are these vaccines going to give us the same protection against the variants, the current variants and the possible future variants? To give you one example of it, the Pfizer vaccine, which has been used very widely in the United States, now there are studies which are showing that against the Delta variant, it may be effective to a much less extent. It's about 42%, which is what is reported, whereas against the previous version or the original version, it was 94% in the clinical trials. So that is a very worrisome thing. At the same time, when we are trying to develop the herd immunity, it is a catch-22 situation because we need to have the coverage through the vaccine to be adequate so that the variants don't pop up again and again. And newer variants, as we have seen with the Delta and the Delta Plus, they seem to be more serious in terms of transmissibility, which means going from one person to another, they do it much faster, much quicker as compared to the older version. So given that, it is rather difficult to predict when herd immunity will develop. If I have to quote Dr. Anthony Fauci, I won't be able to quote him verbatim, but if I have to paraphrase him, he started when they probably several months ago, when he started, he thought about a herd immunity of about 60 to 65%. Now he's talking about a herd immunity of 80 to 85%. So one side is the vaccine, but there is the greater challenge of converting that vaccine into vaccination, that is getting it into the arms of the people. And then we have one more step, and that step is it actually protecting the person from the future infections. So that's why I'm sort of dancing around it, but I'm not giving an exact answer to it because these are the issues for which we don't have answers today.
Is herd immunity the only way to get out of this pandemic? Or it will become an epidemic and kind of slowly peter down?
Herd immunity is one way to bring down the new cases. What happens to the pandemic? There can be multiple scenarios. One, obviously, we would like to do is to eradicate. Eradicate means that there's no cases of SARS-CoV-2 induced disease, which is COVID-19, occurring anywhere in the world. We have done that with smallpox eradication. We have done that, but it took almost 200 years after the vaccine became available from Edward Jenner for this to materialize. So that's one situation. The second situation might be elimination, where we are able to not do it globally, but we are able to contain it in certain regions or countries. Example, if you look at New Zealand in somewhere around August of 2020, the cases were hardly occurring over there. And it was a tremendous tribute to the Prime Minister Ardern in terms of how she was able to coordinate the efforts over there. So that's another possibility. The third one is a cohabitation. The cohabitation is where we learn to live with the virus in some sort of a relationship, which is more of a brokered relationship. That's a possibility. And the fourth one is the more worrisome thing, which is the conflagration, which is where the virus is dictating its terms. That is, it is going to come, just like the Delta virus has done. It came into the picture and soon replaced the older versions and then assumed the center stage. So those are some possibilities. Mr. Agarwal, if I may, I'm going to ask you a question now. What are the businesses doing to secure their workplaces for business continuity? Because businesses are the blood of the economy, and so it is absolutely essential to protect the workers, protect the business itself, and to ensure that it is something which has got minimal disruption.
I think he needs to
Mr.
be
Sanjay, you're mute.
Now,
Yes, yes.
I think we have been also learning on the way as we went along, same as doctors, I must say, because nobody knew about this COVID thing before it struck us, and the same happened to us. So the set of precautions that maybe that we were taking in the month of March 2020, and what we are taking now would be a bit different on the basis of what we have also been able to learn. What I can say is that if we talk of the precautions or the measures that one takes in terms of securing the workplace, I think it's become more or less standardized that any responsible workplace, one would like to have, if possible, everyone vaccinated. And I think different sizes of businesses face different challenges. A small business with, let us say, 5 or 10 employees might have a bigger problem of vaccine hesitancy. If, let us say, 3 or 4 out of the 10 employees are not interested, and then the business also needs to continue, maybe they have a different challenge. A larger workplace, a larger unit which is employing, let us say, 100, 200, 300 people at one site, or maybe like in factories, in my factory, one factory, I've got 1,000, roughly 1,100 workers. Now there, the challenges become different, both in terms of vaccine hesitancy and then in terms of the logistics or actually being able to arrange that many vaccines at the short notice when they are in shortage. Now, nowadays, that problem is not there. But when you are trying to get your business up and running after a shutdown, which is enforced by the government because there was no other alternative to that. So one has to try, one was in a hurry to get the all the people entering the workplace vaccinated as soon as possible. Vaccines were not available. And at that time, probably we were not that much worried about vaccine hesitancy because if this person A was not interested, B and C would be quickly there to take the place. But after having done that, then how to enforce that, what is the percentage of people who are hesitant, how to convince them to get vaccinated, and some who are adamant, then what to do about them? Should you allow them to enter into the workplace and you're putting maybe others at risk? Now, these are all difficult questions which have to be, tackled by individual enterprises, depending on the situation they have. But in general, for example, we wanted to enforce a zero tolerance, but we could not go with a zero tolerance, at least in our factory, because a very large percentage of our workers in one factory were very hesitant and they wanted to work. Now, it would have been amounted to denying them work. And so it became a difficult balance. In the other factory, in fact, in the larger factory, there was a much smaller percentage and we could, still make do somehow. So all these things making the workplace safe enough. Of course, the standard, sanitary procedures which one was following even earlier, but they became de rigueur. One had to be much more careful that all the sanitary practices are being ensured without any failures, and to then be very careful about taking the temperature of the person entering your workplace and looking for the symptoms and making sure that medical help is available to somebody, any of your employee or their family members. So no, these all are not only financially burdensome but also logistically burdensome. But it is the duty of the any responsible employer to do that. But it doesn't, of course, help your bottom line or your business. But it's a tough call. It's a tough time, and we all have to face that. So basically, the precautions I don't say would be much. I think the amount of changes that would have come about in the ways of our doing business, and I think Yash would also be, doing a lot of those same exercises where we have had a very steep learning curve on how to change how we work. That has probably been much more crucial and critical. Like to get accustomed to all this video conferencing which we are doing today, with the best of friends, one was not very comfortable just 2 years back to have a Skype or call or a video call. One would say, "Yaar, mil lenge na." And the same applied for people who travel across continents to have a business meeting, right? And one would say, "Wait, it doesn't give you the same feel." Now look at the mindset is totally changed. But I think that's a different topic. We'll discuss it separately. So, but I would like to know. Yes, I think you have a much larger number of people to tackle with and in more diverse locations than I have. What all did you face and how you tackled?
Well, Mr. Agarwal, challenges have been pretty similar to what you have faced. I totally understand that manufacturing and service industries may have different needs, but being in logistics, we also have a lot of blue collar as well as white collar team members. We have people who are working in our warehouses, who work at airports, who work in ports. So their understanding and their mindset is slightly different from the ones we have in the office. So we had to definitely alter and provide a safer workplace at both the kind of locations that we had. Even in the peak of lockdown, being an essential services, I mean, logistics is an essential service provider. So our warehouses, our port people, our airport people, our truckers, the drivers, etc., they were always working. So it was obviously a big challenge to keep their motivation up and, to make sure that we secure them. So even if it was providing hand sanitizers, masks, PPE kits, so that even if the truckers were going and picking up goods, etc. So there were different things that we had to do for our warehouse and operations teams. Now that things have started to unlock again, things that we are doing to secure our workplaces are different in the offices. Mr. Agarwal mentioned that it was such a thing that we had to firstly counsel a lot of people to get vaccinated. For the whole of last year, whole of 2020, the whole world was talking about when will the vaccine come. But like you said, making the vaccine is one, putting it in the arm is another. So when the vaccine was finally here, it also got along a lot of rumors that, why and if you should get it and you should not get it. So counseling of everybody to get vaccinated was tough. And Skyways took it on them to vaccinate everybody. We took the cost also of vaccinating all our team members. But you can only tell them, you can only pay for it. But eventually, a lot of it comes from their families and friends and their inner circle, who possibly they bound this thing. Also, vaccination per se had a lot of resonance. People had a lot of doubts about vaccination. That was one. In the offices, we had to now suddenly make possibly one person sit in two workstations. So we had to do distancing even while they were sitting. So that was essential because we wanted, at least when a person comes and sits on the desk, they should be able to take off their mask. It's impossible to keep your mask on for 10, 12 hours or 8 hours while you're in the office. So at least we wanted them to take their mask off. Distance. So obviously you can only do 50% of workforce in the available resources that you had. So it meant we had to reset our workstations, we had to reset our offices, and to be able to make sure Then, of course, general sanitization has gone up. We are sanitizing multiple times a day. We are making sure that, masks are available and other healthcare equipment is available in the office in case anybody just so needs it. We also, set up a few facilities. We converted one of our warehouses into an oxygen center when the things were at the peak. So we set up a 25-bed facility just to give oxygen, medicines, etc. Because obviously, business continuity was extremely important. So you had to make sure that, you were able to provide the best possible things at the workplaces so that things never stop. We could not stop even for a single minute. We were always on. So yeah, I think.
And in addition, if I may add one thing, Yash, that work from home also, was a part of making your workplace safe. We ended up having more than 50% of our employees working from home. And that also added, right? I think you must have also been doing the same.
Yeah, absolutely. So now, ever since last year, the concept is not work from home or work from office. It's work from everywhere or anywhere.
Yeah.
Work from anywhere. So you could be working from the cafeteria. You could be working from your home. You could be working from the office. So any place, you have to create an ecosystem in which your team can pretty much work from anywhere in the world. So that kind of an ecosystem, and the ecosystem is not just about providing them gadgets or equipment. It's a lot about mindset. It's a lot about training. It's a lot about acceptance, So obviously, the first pandemic, the first lockdown, nobody was ready for it, and it took us. Luckily, we've invested a lot in technology over the years, so we were on the first day itself. We did not have a challenge to stop, but there were many, many organizations that I saw in our industry in logistics who possibly for the 20th day had not done even a single transaction because they did not know how to tie the knots. There was some piece of information which was sitting in a desktop in somebody's office and they did not have access to it. So there were multiple challenges, and yeah, of course, work from anywhere also brings added costs. It brings added challenges. It's a different kind of a review system that the managers need to follow. Sometimes you want to make sure that the person sitting in front of you and is working. So to make sure that the efficiency levels don't go down, it's a different world. But we're all adapting to it. I'm sure everybody, all service industries of the world are also adapting equally.
Yeah.
But let me just ask that you spoke about immunity, Dr. Gopal and Dr. Mani. Maybe I'll just give this back to you. That immunity is the key. That how can we our entire audience and me myself would like to know how can I do better immunity for my family, my friends. How can we boost our immunity? Maybe Dr. Mani could start with that, and then.
Yeah, that's really $1 million question. I would get $1 million if I tell you that answer to that question. You see, the point is immunity is, both temporary and permanent. And ideally, what we need is a very broad-based immunity, because if the variants are coming, we have seen so many of our COVID, who have had COVID infection, florid COVID infection, getting infected all over again. And we were thinking that once you get a COVID infection, you will have antibodies in your blood and you will be able to prevent a second infection. But we have been proved wrong, and it has been happening. Then came this big thing, which was propagated by the erstwhile president, Trump, who said monoclonal antibodies were the answer. Well, monoclonal antibodies, number one, it's expensive. It's still not very proven. Yes, it does improve the immunity. There is no doubt, because it is antibodies being injected. But again, you see, the ultimate thing is the T cell immunity, which has to be developed. And that varies a lot. There are no drugs as such which will improve the T cell immunity. It has to be nature driven, and it varies from person to person. I think as a public health problem, immunity is more an individual problem and really not a public health problem. Public health is to prevent the infection. So I still feel that there is no one formula which will improve the immunity of public health And can I request Gopal to answer that question? How to have public immunity? Individual immunities are possible with these drugs, individual variation, monoclonal antibodies for people who can afford. But how do we improve the immunity of the public? You, Gopal.
Thank you for that question. I think several ways, and I think it is changing our lifestyle to a great extent. I say changing our lifestyle, I don't mean everybody over here, because I'm sure there are more people who are here who might be much more active than I am. But the thing is exercise. Movement is absolutely essential. And that's good for both the physical health and it is good for the mental health and for all ages. It is important. And how much exercise, that varies. One cannot suddenly tomorrow become a superhuman in terms of exercising for 4 or 6 hours because they saw somebody doing that on television. But moderate level of activity, about 150 minutes, 150. That's about 2.5 hours per week is good. And it is people who already have some health problems should consult with their healthcare provider before starting any kind of strenuous exercise. That's absolutely critical. It cannot go from 0 to 60 like we talk about the cars. It cannot go vroom, vroom, vroom. It has to be done very slowly, but it has to be there. Exercises. Second is the eating a healthy, balanced meal. That is very important. And plenty of vegetables and fruits. It's important. For children especially, it is important to have a meal schedule. And for adults and children, I would say we have to eat mindfully, which means that since we are at home many times, we shouldn't just be, and we may be closer to the kitchen or where the food is, or closer to the refrigerator, whatever it might be, we shouldn't be eating all the time. We have to have that satiety, and that's why it is good to, even though we might be at home, we shouldn't be eating in front of our little screens. We should be moving up and going to where we used to have meals before this work from home situation came about, and that's something which is important. There should not be any stress eating. We all eat, and I'm guilty as the next person. In terms of when I'm stressed, I may eat a little bit more, and that needs to be avoided. So we have to come up with some stress management techniques. And that would be, and we are fortunate because we gave the world yoga. So yoga is excellent, both for to any age. It is possible, and it is good for both the mental health and for the physical health. Because when we talk about immunity, we are talking about an overarching armor which protects us not only from this SARS-CoV-2 or COVID-19 disease, but we are protecting ourselves from a number of numerous other conditions. And that is why, and even if we have some chronic conditions, it's going to get better. That's important. The fourth one is getting some good quality sleep. And most of us, I can assure you, it is a public health epidemic now where people are not getting enough sleep. If you see the teenagers, for example, I have a cat. The cat is always sleeping. I have to learn a lot from the cat. And when she gets up, the first thing she does is forward stretch and backward stretch before she even moves. And I think those are the kinds of things which we need to do. We have to be sure that if we should quit smoking. Smoking is very dangerous. Smoking is the largest risky behavior which we can think of in terms of, and of course, this being a respiratory illness, the connection is very obvious in terms of what we need to do. If we are consuming alcohol, and sometimes it might be because we might be missing our friends that we might be consuming alcohol, but we shouldn't miss our friends too often. We should make sure that we miss them probably once a week, but not too often, not every day. We shouldn't be missing them. And as Mr. Agarwal mentioned before, there is Zoom, there's WebEx, there's Skype, there's this simple phone. So there are various ways to reconnect with our friends. And then, of course, all the things which are mentioned in terms of not getting sick. To give you one example of that, the flu season in the United States kills something between on an average, let me put it, on an average kills about 32 to 36,000 people each year. 32,000 to 36,000 people. Last year, very few. Why? Because everybody was wearing a mask, everybody was washing their hands, everybody was maintaining social distancing. So we cannot forget that important component in terms of not touching our eyes, and touching our nose, and our nostrils, coughing into the crook of the arm or sneezing into the crook of the arm rather than letting it out. And then no high fives, no handshakes, all those basic things which we do, we are going to be well protected. And when all of us are well protected, that is what boosts up the immunity of the whole community.
It's an evening question for India. Well, it's morning in Pennsylvania. Is really alcohol proven to reduce immunity? Because this is a question that I've been asked many times and I couldn't answer.
Alcohol is moderation is good. And that is where the challenge comes. Because when you see the beer commercials, it says drink in moderation, but they never say what moderation is. And then we all set up our own our own benchmark. Moderation. Ideally, if it is a drink, one drink per woman per day, and similarly, it is maximum of 2 drinks per day per person. And again, when I say a drink, it depends in terms of the amount of spirit which is actually in the spirit. So volume matters because volume of consumption of alcohol matters on the basis of the strength of alcohol. So I think that if we are doing that, little moderation is good. And similarly, a related issue is the previously we used to price being underweight. Now it is known that if we are not underweight, we carry a little bit of fat on us. It is actually protective in terms of all disease mortality. So I think things are constantly changing and evolving, but an occasional drink is always good. And at that time, we can remember our friends too. And soon that it might be possible that we might be able to meet them indoors in the comfort of our own homes or wherever we meet them and then share a drink.
Thank you. That's
I think
a good
it's a very,
answer.
very interesting point Dr. Gopal made about the cat. I think that's a brilliant way to tell everybody what does, I mean, an animal was never taught, but a cat knows when the moment he or she wakes up, the first thing is to do the forward and the back stretch. And this is what, yoga brings to us. And this is what we used to hear from our ancestors, that this is what you do. The moment you wake up, you stretch yourself, you do your stretches and then get on with your life. And that will make sure that, any stiffness that you have from your body, from the sleep is gone. So a lot of good habits. I mean, I hope a lot of the habits that have been picked up stay with us. And being a weekend, I'm not sure if everybody was very keen on listening to the drink and moderation part of it, but I hope people are not trying to catch up friends on this weekend. We have a very beautiful long weekend on the Independence Day today. So, I mean, in a couple of days. So I'm sure that lots of friends catch up. I am doing a friends catch up tonight, by the way. So, yeah, so just please carry on. Please carry on. Yeah.
The other thing about immunity is mass vaccination that's going on. Suppose we come to hypothetically I'm saying, suppose we come to a 95% vaccination successful in the country. Will that country be really safe? Kind of safe from the next wave? Or there is no such explanation?
That's a great question. If there are certain diseases for which the vaccines provide a long-term immunity. So it is not just the vaccination coverage in terms of the percentage. Like you mentioned, 95% will be ideal to have that. But is that vaccine, whether it is the 2 doses, whether it is the booster doses which need to be given, whether it is the 3rd dose which might be necessary for the immunocompromised people, whether those things are going to provide long-lasting immunity, because that is what is critical. That's one thing. 2 is, as this vaccination is proceeding, and the vaccination is unfortunately proceeding very slowly. If you look at the entire world, when we look at the entire world in terms of the pandemic, 1.2% of the entire world has been vaccinated, especially in the low-income countries. I have to clarify that. If you look at the entire world itself, about 30% have been vaccinated. So it is a good higher percentage, but only 1.2% in poorer nations have been vaccinated. And this is a disease which can go from one place to another, just like most of the infectious diseases these days, in a matter of about 14 or 15 hours from one continent to another continent. It can so easily spread. So till we have the herd immunity to be a high level. Now, let's take the example of Australia and New Zealand, and both have been very careful in terms of whom they will allow inside. Their restrictions in terms of travel is one of the, for people from outside who want to visit, they will say it is the harshest. But they have it that way because their vaccine coverage hasn't increased yet. So in the meantime, they do not want their population to mix up with people who might already be infected and there could be community transmission. So I think the vaccine coverage is an important issue, but with this particular virus, we also have to think in terms of the variants, in terms of whether it is our own region, which is vaccination, is it the vaccine coverage affecting only one nation or multiple nations, but who is going from where to where? Those things are absolutely critical. There's one other thing which we have to be cautious about this. I came into public health because my first job was with the National Smallpox Eradication Program. That's what drove me towards public health. There it was simpler. Looking back in the rearview mirror, it was simpler because there was only one human reservoir, meaning that only human beings carried the virus. And the virus by nature doesn't want to kill the human beings because then it's dead. For the virus, if I were the virus, I want to move from one person to another person as quickly as I can so that I infect a lot of people. And two, the smallpox, it was very clear when you see a person with smallpox, there's not many asymptomatic cases. So it was very evident. Here we are talking about 30% to 60% asymptomatic cases. That's another thing to think about. So given all these variations, it is rather difficult to pinpoint when we will reach a situation where we can say that the entire world is safe. It looks attractive that if we can reach that high level of vaccination coverage and the vaccine provide long-term immunity, that might be something which is really good.
I asked you this question because of, I used to look up to United States for their successful vaccination program. And now I'm told, the southern states, Houston and other places, they're just back again to the place where we started. So does it mean that they didn't get immune at all? How did the infection come back in such a big way? Now I'm told there are
That's
no
a good question. There are two aspects to it. And I think we talked about it in terms of one, vaccine is a medical tool or a technology innovation. Vaccination is a behavior. It is like whether we exercise, we don't exercise, whether we are going to eat the right food, whether we are not going to, and as Yashpalji said, is whether we are going to be celebrating enthusiastically, over-enthusiastically, or in moderation. All those things are important. And that's where the issue is. Right now, if you see the cases which are occurring in several states, whether it is Texas, whether it is Florida, whether it is Louisiana, Mississippi, Alabama, all those places, the epidemic, I would say, restricted to this nation, epidemic is restricted more to the unvaccinated people. The vaccination coverage in the United States, where people have received the full dosage of the vaccine, is about 50%. Where people have received partial vaccine is about little less than 9%. So in total, we have about 59% vaccine coverage. Today, I could walk into many places, whether it's a hospital, whether it is a clinic, whether it's my doctor's office, whether it is a drugstore, I can walk in and get the vaccine. But people are not getting the vaccine. And so we are seeing that the hospitalizations are gone up. And many of the states now have, I shouldn't say many of the states in the states, which have been greatly affected, many of the hospitals in those states are having a great problem in terms of if they see increasing cases, they won't be able to take them in.
Sir, does it have something to do with the politics? Does it have something to do with the politics in the sense that Republicans, it seems, are skeptical of even masks being used, right? And these are the states probably which I don't really know the political landscape, but probably I would think the Southerners are Republicans, right? Is that also a contributing factor?
I would say that some people would certainly subscribe to that viewpoint, and I want to be apolitical over here, so I would say
it's not about politics. It's only about the wearing or not wearing of mask.
Yeah, No, it is three things. One, it is the question of getting the vaccine when it is available. That's one thing. So it is some people are vaccine hesitant, some people are anti-vaxxers. They don't want the vaccine. There are a lot of questions about the mRNA vaccine. So that's one thing. Second is the mask. Masks we know are protective. It is the easiest thing which any one of us can do, even though it is an inconvenience. Mr. Yashpalji mentioned that it is an inconvenience. If you have to wear it for 8 or 9 hours each day at work, it's an inconvenience. But all these inconveniences are relative. Dr. Mani, when he goes into the hospital, he's going to put on that personal protective equipment and he's going to be there in the OT for 8, 9, 10 hours at a stretch, and it is much more cumbersome for him. So we have to look at it that way. That's the second thing which we have to think about. The third thing is the social distancing. The social distancing, especially in indoor arena, for example, restaurants, those kind of places. People say that they still are not convinced that why should they keep the 6 feet distance? Why should they do that? What if I don't do it if everybody else is doing it? So that feeling of community, that I can do something for the community, hasn't become entrenched yet. Because they initially thought, and I say initially because a lot of them thought that they won't get the infection, but now they get the infection, they're hospitalized, and some of them are dying. Before they die, they are coming to realize that a simple vaccine, which is so readily available, would have made a difference.
Interesting. Can I just ask a very quick question on masks since we're talking about it? I saw it in the question bar as well. Is it okay to wear masks when you're doing some physical activity like morning walks or running and cycling and things like that?
Outside masks are not required, especially if one is unlikely to come in contact with people who are protected or who are not infected at this point in time. Having said that, I would say that if the person is comfortable running or doing the exercise, and if they are wearing the mask and if they're comfortable with that, they should do that. People who have immunocompromised, even if they are walking, then they should be wearing the mask because the threat to them is greater than the benefit of not wearing a mask.
So it's a very individualistic thing, you mean, that if your immunity is strong enough to take the stress of wearing a mask while doing a physical activity, you can. Otherwise, avoid.
Plus, I would also add the distance between the place where the person is exercising. For example, how the machines are placed, whether every machine is being occupied or every one is skipped, the alternate machines are being kept. And also the ventilation. I think ventilation is very critical in terms of the mask. And I think in the future, as we go into the future, I think two things are going to be important in terms of the mask is how well the mask fits and how long we wear them.
So outdoor as
When
well.
we saw the
Outdoor, sorry, outdoor as well. I mean, mask you spoke about inside, but outdoor as well.
Outdoors is fine if you are maintaining social distancing. If we are going to maintain 6 feet social distancing, outdoor is a safer place as compared to indoor in terms of mask wearing. So the recommendation would be that if people want to wear masks, they should be allowed to wear masks. If people don't want to wear masks and they're sure that they are not infected with the COVID-19 and they are sure that they are going to maintain social distance, it should be fine. They don't have that.
Dr. Mani, you were saying something.
Yeah, I was just asking Gopal, would he have allowed the Olympics to be taking place the way it did? I don't think they were very religious about masking.
It's see, hindsight is 2020. But then a lot of things were riding on the Tokyo Olympics. One thing, of course, certainly was the economic aspect of it, and two is the sports aspect of it, because there's so many people who have trained so hard for so many years, not just and for them to be able to compete and for them to be able to show what they have. And when you see the records being broken, that's the reason we watch Olympics and watch any of these major events, sporting events, is because it shows us the resilience of the humans, and it also shows us the how much humans are capable of performing. So in hindsight, I think it worked out well, hindsight. And because one thing which was very worrisome was that Tokyo and many of the other major cities in Japan was actually seeing an increasing number of cases at that time when Olympics were held. But somehow they still managed to do it pretty well by creating essentially a bubble or a cocoon in which they could encase the people who are participating and the people who are accompanying them. And by removing that huge crowd of fans, which I'm sure disappointed a lot of people, millions of people, but doing that, it still was a good way to have it, because that's what, in hindsight, if you had asked me the same question about 2 months back, my answer perhaps would have been different at that time.
Yeah, but from a personal standpoint, I see that when I'm, we have a gym at home, and when you're doing exercise with a mask, you really get out of breath very quickly. So I think if you are in a protected environment and you're far away from others, I think you can unmask yourself and do your exercise things in the morning. Because as you told me very clearly, exercise has got the benefit of not only reducing your belly, but increasing your immunity. So if it requires demasking, yes, I think we should go ahead at that particular time. This is my thinking.
And in the privacy of one's office, in the privacy of one's home, demasking is perfect because you know whom you are with. But when you're outside, as Mr. Sharmaji said, is when you're outside, let's say in a gym, then one is not sure whether the other people have been vaccinated or not, because gyms don't require people to show their vaccination card or proof of vaccination before allowing them in. I think those kind of things might come in the future. We don't know. As vaccination becomes more prominent, they have businesses might say, for example, when we go to an eatery, a restaurant might say that, yes, you need to have it. A good example of that is San Francisco. It came up with this whole idea of proof of vaccination for getting into a restaurant and having a meal, and it came out only this week. So I think that sort of a shift might occur, but I don't think we should be over worried in terms of masking in places where we are rather certain that the people around us are not infected.
Let me just take a few things about businesses. I mean, Mr. Agarwal, maybe talk a little bit about manufacturing. What's happening in that landscape, how things are getting different, and what are the impacts that we are seeing on the businesses of tomorrow, for example, especially from a manufacturing standpoint.
You see, manufacturing has had a very difficult time. I think it's very easy to say manufacturing because I am in manufacturing. I know in your field you would have probably a more difficult time. What to talk about people in the hospitality industry or in the airlines industry? I think everybody has had a very tough time. It's been a very horrid time for everybody, I must say that. I think there are certain lessons in manufacturing which, for example, is going moving up from even the small scale or MSMEs right up to the largest corporations. One big lesson is that the just-in-time approach has to be thought about again. Earlier, just-in-time approach used to be a measure of how efficient you are. What is the minimum level of inventory you can make your factory work with without a glitch? And today, it seems with the uncertainties around you, when a lockdown might happen, what movement might be restricted, your supplier might come under a local lockdown, or your supplier might be under or a state, one full state could go into a lockdown while your state might be open. Now, all those things, it's not that the whole ecosystem goes into a lockdown. The way it works, except for the first 2 months of the lockdown, is that your customer might be working and you are in a lockdown, or you might be working and your vendor is locked down or your customer is locked down. Now, these throws up a lot of challenges, as to how to plan your inventory, how long you need to, and there is related stress it puts on your working capital, because it's not just saying that, okay, I'll keep a 1 month stock or a 1.5 month inventory. Whatever you do, it's going to need money to do that, right? Then on top of that, how to plan for your customer going into a lockdown. As a manufacturer, I have suffered both. my supplier not being able to sell to me, my customer not being able to accept. Now, in addition to all this is only one part, the logistics part. The other is the impact on the economy. How you, what impact it has on your demand, on your overall market conditions. Now, demands in most of the products went down. If you look at the impact on the Indian economy in the first quarter of the last financial year, which means April to June 2020, there was a 27% reduction in the GDP. Now, 27% reduction in the GDP is not something to be sneezed at. And overall for the year, we lost something like 7.5 or 8%. I'm forgetting the exact number. Again, every year you are expected to grow. You are a country with a growing population and with a continuous inflation. So if you were at 100 last year, you are supposed to be at least 106, 107. Our growth had already started slowing down for the past 3-4 years. We were from 7 to 8%, we were down to 4-5% levels. And then what happened? If our economy was at 100 rupees in 19 for March year ended by March 20, sorry, March 21, 100 became 90. Now, if you say that you are going to grow 10%, so then 10% on 90 is 99. You'll still be ending up being 99 for a number which is 2 years old number. So the number at the end of March 22, you'll have a lower number at the end of March 22. And it has a very deep impact on businesses, whether you directly experience it or not. It has an impact on demand. It has an impact on consumption patterns. It has an impact on various aspects, including the the viability of the industry as such, because it's not just this one factor or two factors. It's a combination of credit stress that happens. The banks have become very difficult. On paper, they are not extending any loan except where they've got a government guarantee, and the government guarantees are with so many riders, so it's not so easy. 3 lakh crore worth of emergency credit line guarantee scheme was announced by the government last year for MSMEs, and it's now more than 1 year, and they've still not exhausted that 3 lakh crore. One would have imagined that we have got 6 crore MSMEs in this country, and 3 lakh crore we are unable to consume. Then coming to logistics, freight costs, container costs, I think Yash would have hundreds of things to say about that. But I am being a sufferer, I also have to say that. My freight costs, my containers, what I'm exporting to the US, to UK, it's becoming unviable in many cases. Some of my customers, I am not able to accept an order simply because the freight has become totally out of my reach. The customer is not willing to pay for it and I can't absorb it. Then these imbalances, they caused a huge surge in commodity prices. That has been the biggest challenge. Metals have gone up from 1.5 or times to 3 times, even 4 times in case of steel. The customer does not have the money in the pocket to pay for that. Now, all these things make for a lot of recalibration, a lot of things to have to be looked at again. And I'm also the president of the PhD Chamber of Commerce, and we are continuously in dialogue with the government, trying to egg them on to invest into the economy, to spend on infrastructures. We had this plan for national infrastructure pipeline, 100 lakh crores. Now, 100 lakh crores, we have not even seen the first 5 lakh crores being spent. We need that money to be spent. We need something like the Marshall Plan or the New Deal that happened in the US after their depression. You have to spend money on the economy, spend it on the infrastructure, and then maybe we'll revive demand. So it's been a challenging time, and I think these challenges will continue for a bit, because by March 22, we will still not be reaching the level of the economy that we had as of March 20. Yes, I think now you would probably have much more to add, because you have every possible sector of manufacturing, trading, whom you deal with, right?
Yeah, quite true, actually. So your points are bang on. I definitely see a big stress on industry, in terms of the input costs. The input costs have gone up tremendously. Even from logistics standpoint, we are seeing anything between 2 times to 15 times the escalation in the freight costs, depending on the sector, depending on the product that one has to move. And many products, obviously, the cost of logistics compared to the cost of the product is extremely high, which makes manufacturing sometimes very unviable. Now, what I'm seeing though is, lot of changes in terms of how the customers are adapting to it. And I'm seeing this upstream as well as downstream. So a lot of stocking has changed. Like you said, Mr. Agarwal, talking about just in time, and just in time meant failure. You imagined कि ये निकम्मा है, ये इसको planning नहीं करनी आती. That is why everything is coming just in time. That was the thought of the past. Today, or pre-pandemic, everything was just in time. You wanted to do just in time to save on cost. You did not want to have high inventory levels, because higher inventory levels meant inefficiency. So that was shown as, so from a just in time being inefficient, you became stocking as inefficiency. So there was a complete change. So when the pandemic is hit, it's obviously brought sea change in the way organizations need to look at their stocking. And like Mr. Agarwal mentioned, that it may not be the customer or himself who might be in a lockdown situation, but the vendor is. So you need to know, okay, how is your vendor portfolio currently positioned, which geographically how they are positioned, and even if they are positioned in different,
probably having spread them out, maybe, but even that is not a full solution.
Absolutely. So I'm saying that, how you stock, sometimes, you want to procure goods and you want to stock it at different places so that, you have different accessibility to your stocking zones around the world. So the stocking, the way we see stocking pre-pandemic and now has completely changed. And usage of various modes of transportation has again, customers are more willing to look into how effectively they can use multimodal. Suddenly you will see that air freight is not as expensive as it used to be in the past, compared to when you look at the ocean movement that you need to do. The ocean pricing have gone sizably high, and maybe in certain cases you might find that air freight is actually very competitive when you look at the other benefits that air freight brings in terms of, quicker goods, quicker turnarounds, your lead times could get better, so your payment cycle could improve. So when you look at that, you might say that, so usage of multimodal has definitely gone up. What we see from a downstream perspective, from a customer side manufacturing, that a lot of manufacturers are relooking their product portfolio as number one, because the products they could possibly sell pre-pandemic could have changed. I mean, I know for a fact that a lot of garment manufacturers have moved into, a lot of healthcare manufacturing, like masks, PPE kits, etc. So they changed their product portfolio. Similarly, a lot of FMCG companies have changed their product portfolio. You see from a lot of companies have shifted gear and moved more into ready to eat, ready to cook kind of a product base. So a lot of organizations are relooking their product portfolios. Also, the omni-channel sales strategy has become even more prominent now. You can't have a physical sale mechanism. The pandemic, the industries that could go to the customer to transact are the ones that did well and the ones who thrived. The industries where you needed the customer to come to them, unless you're in a healthcare industry, hospital, you need to go. But if in industry you need the customer to come to you to transact, those businesses suffered big time. So there has been a shift of how the businesses are relooking their omni-channel strategy, how much is going to stay in brick and mortar and how much is going to get online, and how effectively logistically you are able to position or reposition your selling stocks is what is extremely important. So I see a big shift or a big change between how the organizations or manufacturing also needs to look at their upstream as well as downstream, and the organizations that will be most resilient, most adaptive will possibly, I think, will come out better. And just to add a point on the logistics side as well, I don't see the ocean trend changing very quickly. This thing is not going away. A lot of it is artificially created, and I believe so that shipping lines have also been partner to this creation of where. Absolutely, there's a huge amount of. I can talk well on it for last 10 years, what has happened and how the 10-year journey I mean, the pandemic and the period has just been absolutely apt for the shipping industry. All those shipping lines who were probably building it up by dropping rates to absolutely crazy levels to wash out competition or to acquire them are now reaping in the benefits, and possibly the money they will make now is going to stand good for the next 20 years. So yeah, I mean, I see a lot of challenges currently for manufacturing, and it will be important that organizations relook their logistics as well as their product portfolio to be able to compete better going forward. I think we've had a lot of time, so let me just give in a quick last any takeaway. I mean, one thing I would definitely like to ask before we go in about the kids, that everybody is worried on two aspects: the mental, psychological impact that especially the second wave has had on people, and number two. So I'm not going to talk about the rebel tourism, but the general negative impact that people have had because of the second wave. And second, the impact it's having on our kids, because we are all very concerned. My kids are not going to school; they are staying indoors. So there's a complete psychological impact that a lot of people, and especially the kids, are having. So maybe a quick word or two by all of you on this. Maybe Dr. Mani will start with.
You see, as far as the long COVID, this is a new entity, a medical entity. The effects of COVID don't go away with the RT-PCR becoming negative. Some people have had long-term psychological imbalances. Some people have taken to drinking. Some people have become depressed. So this is one aspect of COVID which we never thought would be an issue. And my psychiatrist in Max Hospital is very busy. He gets more patients than he got before. So and probably one thing is good that has happened in India. People were always thinking that depression is a stigma. Depression is something bad. Now people are getting over that feeling and discussing their depression openly. And with the COVID, whether it is directly because of the virus or the deprivation, there has been a lot of psychological impact on large number of people. So this is one aspect that we have to think. There are patients who have been, quite fit, suddenly having heart attacks. Now, whether the blood has become more thrombotic, whether the blood has started clotting. So there was a lot of long-term anticoagulation that was suggested. So these are all problems which are very peculiar. We never, as you all know, all of us have faced this COVID just once in our lives. So there are lots of hit and trial methods which are going on. Anticoagulants have got their own problems. So, random anticoagulation for the whole population is not recommended, because people who are on anticoagulants, if they have a fall, they have head injuries, they have hemorrhages. So we can't recommend it across the board. But psychological impacts, cardiac problems, they are all surfacing more than what we thought. And I'm sure Gopal could also throw some light on this. Yeah, the other question about schools, I think that's a good question for Gopal.
Thank you, Dr. Mani. I think there are two aspects to it. One is the parents. The adults have to be calm if they want to keep the kids safe in terms of their mental and physical health. I would go to the analogy of what we hear when we are flying. Just before we fly, the flight attendants come and say that if there is an emergency, the oxygen mask will come down. You put it on, take a deep breath, and then help the person next to you. I think we have to practice that. Children are like, pardon my saying, that shows my love for the cat, is children are like small pets, irrespective of their age. So they are going to be ruffled if there's going to be a change in terms of circumstance, which certainly has occurred over the last 18 months. So they are going to be worried about what is going to be the future. They're going to be worried about what is going to happen to the parents. They're going to hear things. They're going to be uncertain about the future. They're going to be more clingy. All those things similar to what the pets behaviors are. And so the adults have to be strong, both mentally and physically at that time. And that's why we talked about how to boost the immunity is to stay strong by doing some of our lifestyle behaviors. And if we do that, same thing holds true for the small children. If they are 0 to 5 years of age, and if they happen to be 6 to 12 years of age, there are excellent guidelines which are available from the Indian Academy of Pediatric website. Just to mention a few of them, kids have to be kept active. They get bored very easily. So the same things which we talked about, whether it is breathing exercises, we don't have to call them pranayam, but if you say that fun breathing exercise, I'm going to take 5 deep breaths. Can you do that? Can you beat me? So it's a little friendly competition, but that's going to help them. Connecting with others, sleep hygiene. I call it sleep hygiene. It's not just getting enough sleep. It is when do they go to sleep, and then whether 1 hour before going to sleep, they switch off any kind of screen which they have, and then there should be a calming routine so that 30 minutes before they go off to sleep, there has to be a calm. They shouldn't be running around at that time. They shouldn't be asked to do any task at that time. So it is a question of slowly introducing them to rest their brain. That's what sleep does. Rests our brain and rejuvenates it, and that's something which is absolutely critical. When they're awake, of course, we have to make sure that their nutrition, just like what we mentioned for the adults, all that nutrition information is important. Physically, what are some of the things which they can do? They can dance to their favorite music. If they can go outside, they can do that. They can catch ball inside the house if it is safe to do so. They can jump rope if it is something which they can do, whether it is inside or outside. Every opportunity when they can go outside, they should be allowed to do that. Keeping them hydrated, this is critical. Keeping ourselves hydrated, keeping the children hydrated is absolutely critical. When I say hydrated, it's water. It's pure water I'm talking about. I'm not talking about any juice. I'm not talking about anything else, because they come with their own problem. Then it is also necessary that older children might lose the motivation. They may, because they have been sitting in the house cooped up, and then they lose motivation. So there has to be something for them to connect with. And connection can be with neighbors, connection can be with their old friends, connection can be with new friends. If they can go out for a walk, it is always a good idea to go for a walk. And music is a great, great thing, not just for the mind, but it is also good because people move. When their favorite music is being played, they are going to move, and that is something which is absolutely critical for them. And then the other thing to do is all the things which we have talked about, whether it is hand washing, whether it is the not touching the face, not touching the mouth, ear, and then eyes. Those kind of things have to be done. And then parents have to be honest and then talk to them, because they're going to have fear, they're going to have questions, and those questions need to be answered. And the critical thing, which may be a surprise to many people, is that watch less news. When we watch more news, we think the world is coming to an end. The world is not coming to an end. There will be an end for us, but the world will still go on. So I think that's absolutely critical for young children also, whatever their age is, that they should not be watching the news all the time. Because the news always is, think about it for 1 second, is how many times do you hear good news? The news. Good news is not news. Bad news is all the time on TV, on the little screen. So I think if we can, if we can create a barrier between that bad news and our children, I think their mental health will greatly be preserved.
And suddenly the news is equal to TRP. So if the TRPs are good, it's a good news. If it's not a high TRP, it's not a good news, you know. So that's
and TRP you get only if you are delivering a shock, right? So you have to deliver a continuous stream of shocks.
Well, I could scream, you know, on this show as well, you know, as much as, and I don't let any one of you speak.
So you'll get some good TRPs of that.
Mr. Agarwal, any takeaway from you on things for today?
Well, I think for me it's been very educative to have some, two senior most doctors and respected professionals in the medical field who actually are the people who are, guiding hundreds and thousands of people on a daily basis to be there with us to share their views and to respond to our queries. It's been very satisfying, and I must say that the one community which has faced the maximum challenge, despite of course there'll be competing claims. When a factory wala comes up like me, or a hotel wala comes up, or a logistics wala like you comes up, but I think the medical community, the amount of physical, mental, every possible stress that has been faced by our doctors in terms of A, working for endless hours, B, having that tension in their minds for what they know and what they don't know, because there was no means of knowing. And, and then I think the sort of responsibility you carry, and then on top of that, constant questioning by people. ये करूं तो क्या होगा, what will happen, and sometimes you know the answer, sometimes you don't even know the answer, but how many times can you answer? But I think even when I would meet Dr. Mani, I'll still ask him, just for the heck of it, just tell me, Dr. Mani, what to do about this. So I think this must be a very, very tough time for our doctors, and I must say that no way less than any soldiers on the front, because the risk again that the doctors have taken all through this is also not something that one can imagine any normal person being able to take. So hats off to all the doctors and our two doctors who are there to today advise us. So it's been a very rewarding evening for me. But just one small thing I would like to add on the subject of kids, what Dr. Shankaran was talking about. I was in a webinar recently in which it was about education. And mind you, that education turned out to be just tele-education, and the catchword, the catchphrase was K-12. Now, I thought that I heard of K2, which being a mountain peak, but what's K-12? So then I was told that K-12 means kindergarten to the 12th standard virtually. So,
Oh my God.
I said, you want the kids to be locked up for 13 years? He said, that's what the world's coming to, and we are going to reap big money out of that. Those were the guys who were real professionals in that field. So,
Oh my God.
if that is going to happen, then let us be very clear that the children, the kids, need to be having a very, very strong routine with a very strong screen time hygiene also. As Dr. Shankaran said, a good sleep hygiene, I would say a screen time hygiene with very, systematically, defined hours that a child would be spending on the screen, whether television or computer, and then how much for work, how much for play, because even play is computers half the time. So that would also be another concern. Thank you so much. It's been a pleasure.
We look after the lives, you look after the livelihoods.
We have to try our job. It's not as hard as yours, but we'll do our jobs.
No, absolutely.
I just want to say that it has been great. And I just want to, a lot of the things which we see right now may look to be very bleak, because we are talking about a disease and we don't know a lot of answers right now. But if you look at historically, humanity has always survived. Human beings are resilient. The only thing which we may have to learn, as Joshua Lederberg, who is a very famous biologist and he was a Nobel laureate in biology, said, the microbes came millions of years before humans came, and they're going to be staying for millions of years after human beings leave. So the point is coexistence, and not worry about every little thing which is going to be there. So my own life, when I look at it, it used to be on 3 pillars, now it's on 4 pillars: love, hope, faith, and humor. I think those 4 things help me. So you have to find out your own things in terms of what helps you, and then stick to it. There is no one formula. There's no one shoe which is going to fit everybody's thing. But everybody has got that inner resilience, inner thing to survive. And as Darwin said, it is not the strongest who survive. It's the people who are ready to adapt to the changes. So we are not going to go back to the old normal. We are going to create a new normal, because the old normal has killed a lot of people, across the world. So we are not going to go back to that old normal. We have to create the new normal. So anytime when you want to worry about it, don't worry. Think about what can I do differently? What can my family do differently? What can our community do differently? What can the workplace do differently? And I think this is a wonderful opportunity for us to take a step back and then think about it. And being the long weekend which is coming, there's something which might also help us to think more, as Mr. Espalji alluded to, whether we are with friends, whether we are not with friends, but that might be collective thoughts, and the collective thoughts are always more powerful than the individual thoughts. Thank you.
So, Dr.
Thank
Mani,
you, Yash.
something from you?
No, I was just saying, I think you have exceeded our
Yeah.
plan. I think we should wind up, and so that we go back, go home, sleep early.
I want to take some questions from the audience because they've been listening to all of us. And before I go to them and before I go to our chairman to say a few words, what I think is that, like Dr. Gopal mentioned, mankind has stayed for centuries. We've lived through for maybe 10,000 years or so, or maybe more. And I think God has his own way of realigning or transforming things when they go out of hand. I think humans took a lot of things in hand, which is what needed to be taken out of their hands. So we are just seeing God taking things in his or her hand to making sure that he tells us what is right and what is wrong. There were lots of rights that we used to do in the past that we over the years eliminated from our lives, and we need to correct them and get into the new normal. And also I feel opportunity for industries to look at, if we're going to see K-12, which is, I hope it never happens, but if it has to happen, then we must have the industry prepare us and the equipments for it. I'm sure you are going to see better screens that will be able to give us better screen time, because it's going to be inevitable. Everything's happening on screen, like we heard. So if the screens are going to become, if they are not going to become effective, we will need more glasses, or we might lose eyesight sooner than other. But I'm sure humans will come out of it and will get us the kind of technology which will help us to have a better screen time than what we had in the past. Thank you very much. I will just quickly bring in our chairman. Mr. S.L. Sharma, has been part of the industry for 50 plus years, founded Skyways Group in 1983, well-known person. He's been a Rotarian. Dr. Mani knows him well. Mr. Agarwal knows him. He's been a very active person in all industry forums, associations, represented our industry in various places. Also happens to be my father. So I will just let him to say a few words before I take the Q&A. Mr. Sharma, over to you.
Thank you. Yes, thank you. Yes, thank you very much. Ladies and gentlemen, on behalf of Skyways Group, it is my extreme pleasure and honor to address this wonderful virtual conference. The last 50 months have been extremely challenging for everyone. From health to economy, all have been under huge stress. The second wave in India has taken a big toll on everyone. Not just physical health, but even emotional health has been affected for all. I am delighted that we have had few of the best minds on this webinar today, discussing the possible short-term, mid-term, and long-term impacts of this pandemic. Their wonderful deliberation on the ways in which mankind needs to reboot economic system and indeed enlightenment. The event has addressed some basic and key challenges that use a collective approach to enlighten the future of our family, society, and the businessman. The point Dr. Mani made on the psychological impact on mental and physical health has been very brightly taken. Dr. Gopal has very rightly, I think, about how to boost immunity. Mr. Agarwal has really right just in time, logistic and just in time. He has related a lot of challenges in the industry are there. The point by Mr. Agarwal, how local and global industry mapped with the background and how they have planned their future courses. I would like to compliment the radiances and character shown by mankind and my Skyways team during pandemic. There was much of support for such each other society. Everybody has worked very well. Everybody has worked day and night. And just, I think, just like Agarwalji said, that just in time, we have done our job. We have done our all assignments during this period in a very professional and efficient way. Lastly, I would like to thank the panelists who spoke their valuable time and being a part of their webinar. I'm sure the deliberation would help many of us, including me, to energize ourselves and look at a higher, brighter future. I wish you and your families safe and healthy days ahead. Thank you very much.
Thank you, sir.
Thank you, Sharmaji. Very happy to actually see you today, even if on a screen, but we have to meet physically, ASAP, right?
Definitely. I'm sure he's looking forward to seeing everybody. I think he's having some internet issues. His signal is a little weak, I see. But he's somebody, you know, he's somebody who's very keen to be meeting people in person.
Oh, he is one of the friendliest people I know.
Thank you. Thank you very much. I'll just take a quick few questions. Largely, they are from, from the healthcare side. So the first one comes in from Calcutta, from Raja Ghosh. How long the vaccine will be effective or work in your body once we take both the doses? Again, $1 million question, I guess. So I'll let Dr. Mani and Dr. Gopal quickly.
Well, I think already there is a talk about the booster dose, and we were estimating the antibody levels to suggest whether the immunity is adequate or not. But the WHO has kind of advised us against it. So monitoring antibody levels are not a very secure method of ascertaining immunity. Yes, random booster doses have been discussed, especially for high-risk individuals, especially in the healthcare industry. They need to have booster doses. Once, say, I think the ballpark time is about a year. But again, I'm not an authority on this. I think Gopal can throw more light on this.
I think the excellent, Dr. Mani, thank you. I think it is, we don't know the exact length for which, because the first vaccines were given in December of 2019. So our experience with this whole thing is rather limited in terms of long-term effect. But what we are seeing is that there is a decline in terms of the antibody levels. And as Dr. Mani said, that we might be able to have this antibodies level protecting us against reinfection for perhaps for anywhere from 8 months to 12 months. And that is the reason for talking about a booster dose. And it's also another reason for talking about the booster dose, as I mentioned earlier, is that the vaccine which we have received may not be as effective as against the variants, and then we do not know what the new variants are going to be. So the booster doses certainly are going to be, cannot be eliminated. I have to say that that's certainly on the horizon. And already the people who are immunocompromised, for whatever reason it might be, because they have certain diseases or they are receiving radiation, they have had organ transplants for which they are being put on immunosuppressive drugs. All those people are being advised very recently, at least in the United States, to have a booster vaccine, and it has received the emergency use authorization from the Food and Drug Administration. And I'm sure the same thing will follow in other countries from their respective regulatory bodies. So that's going to occur. How many booster doses, how frequently it needs to be given? I think that is something that's very speculative, because the vaccine, every generation of vaccine is getting better and better and better.
Thank you. I have a question quickly from Mumbai, from Ramesh Dandore. Are monoclonal antibodies are more effective than the vaccines? And if yes, then for how long?
Gopal, go ahead.
I would say that the monoclonal antibodies, one, it is very highly individualistic. We cannot use it for the whole population because, one, to create it, and also for the expense which is associated with it. The monoclonal antibodies are perhaps going to be most useful for people who or recently infected. Whereas the purpose of the vaccine is to make sure, at least with the current vaccines, the older type of vaccines used to be where we didn't want any infection to occur. Here, the infection occurs, but the severity of the infection, which leads to hospitalization and death, is certainly and markedly reduced by this vaccine. So those are some differences. So I would think that the individual level monoclonal antibodies has a future, but at a population level or community level, it is the vaccines. One other thing which we didn't talk about is the possibility of therapeutics, meaning that some kind of drugs which might be coming in, and there are a number of candidates which are in clinical trials, and there were a number of candidates which were talked about, but which didn't really pan out. Different nations have tried out, for example, hydrochloroxy, I'm sorry,
That's why Tamiflus and
exactly the number of things which are used against the against influenza. They have tried to use the ones which have been used against malaria. There's the ones which have been used against parasites. A number of things have been floated around, but there are not clinical trials which are going around, and there's some medications which are common medications which might be possible in terms of not curing the disease, but removing the signs and symptoms associated with it. Because viral diseases are rather difficult to cure as compared to bacterial infections. So that is in the horizon. We didn't talk about it, but that's something which is a positive thing. If it comes, then we are going to be stronger in terms of its use.
yeah, that'll be great, because vaccine is a prevention and we need some drugs to ultimately cure. We need cure drugs to, if in case somebody still gets it, and that will be awesome to get something out for COVID very, very soon, because that will help us from both sides, to get protected. One quick question that, for the kids, I mean, especially the current vaccines, is there a current set of vaccine which should not be given to kids? Or is there a vaccine which is preferred to be given to kids whenever it is allowed to be given?
Most of the vaccines at present have been authorized in different places at different ages. So if you look at the Pfizer vaccine, which is common here, the mRNA vaccine has been allowed for, when it came in, it was allowed for people who are 16 and above. And now the vaccines which are available are from 12 to 12 onwards. So the studies are currently on for children between the age of 5 to 12. And those vaccines may become available late into the winter. So right now, we don't have vaccines which are readily available for children as yet. And the reason for that is there is a layer of additional protection in terms of clinical trials when we deal with pregnant women and for children, just to mention two of the groups. For pregnant women, now the vaccines have been cleared and the vaccines are to be given to pregnant women, and there hasn't been any long-term effect. One thing I do want to mention is that when we take it from a clinical trial and apply it to a large population, as we have done, the doses of vaccines which have been distributed across the world is something like almost about half the population of the world, which is about 7.88 billion. So many doses have been distributed. When we do that, side effects are going to be seen. Some of those side effects might be quite severe, including death is going to be seen. But then the media catches hold of it, and then we all think that, oh my God, there's a lot of cases which we are seeing in adverse reactions to the vaccine. What we don't see is the denominator, out of how many. And it is necessary for us to have that perspective. And the second thing which we need to be cautious about is that we have to weigh the benefit of the vaccine versus benefit, I shouldn't say benefit, the risk of getting the disease and then dying from the disease or coming out with some long-term or long-haul COVID, as Dr. Mani mentioned.
Oh, good. Sounds good. Sounds good. I have loads of questions. Believe me, I think, a list of 30 questions, but I think the time is short. We've really overshot the time from a long bit. A big thank you to all three of you gentlemen for sparing your time. I think we've had some fantastic inputs. If you will allow me, I might send you a list of these questions. Whenever you have time, if you would reply to them, it'll be great, and we will send out replies to the people who have asked the question. So, whatever we possibly has not yet been answered through this last 90 odd minutes, I would request you to please just anytime, I mean, there's no hurry, but we'll send out to you early next week and maybe over a span of next couple of weeks. If you could just spare time and reply. There are lots of business questions. There are lots of healthcare questions. So I will send it out. We will filter them and send it out to the three of you. Thank you very much once again. Ladies and gentlemen, I hope you had a very engaging and interesting session. I think I picked up loads and loads of points. One clear thing, good habits, stay happy, sleep well, meet your friends in moderation, enjoy the weekend, Jai Hind, and happy Independence Day in advance to everybody. Thank you very much.
Jai Hind.
Thank you.
Bye-bye, everyone.
And thank you, Yash.
Thank you, sir. Thank you so much.